Hello everybody, my name is Dr. Faizan Aziz. I'm a consultant pulmonologist at Zoy Hospital, Amirpet. Today I am here to speak about the post-COVID complications or the post-COVID sequelae that you may call. As you all might be aware that it's been more than 2 years since we have been hit by the COVID pandemic, and the kind of enormity of the disease and the colossal damage it has caused to the mankind all across the globe. Uh, so today, basically, I am going to speak about the post-COVID complications or the post-COVID sequelae that people are encountering in our day-to-day OPD. So COVID has always been a multi-systemic disorder, obviously starting out with the lungs, but involving the other organs of the body also. Basically, the post-COVID sequelae or the post-COVID complications can be categorized into mild, moderate to severe. Mild symptoms can be as easy as fatigue, generalized weakness, myalgias, body pains, and not being at your optimum best health-wise, a feeling of weakness, lethargy, body pains, headaches. A few patients have also been reporting of cases of loss of sleep, anxiety, depression, something on these lines. And basically, not feeling at your optimum best, reduction in your exercise tolerance, you feel you're feeling short of breath, having mild cough, and basically these are the presentations that can be categorized as mild to moderate. So patients with any of these symptoms need to have periodic checkups with your consultant pulmonologist, physician, and then just get a few routine blood workup done. Probably get a HRCT chest done to see if there are any post-COVID complications in the lung. Basically, have a multidisciplinary approach so that you look into each and every organ and just evaluate, get a few routine investigations done. We have post-COVID clinics here wherein you can walk in, get yourself evaluated. So these are symptoms which are basically called as post-COVID fatigue. It's a syndrome, basically with amalgamation of all these features, which can be categorized as post-COVID syndrome and post-COVID fatigue syndrome, as I may say. So the time period in the syndrome can be, it's variable, ranging from 4 weeks to a maximum of 12 weeks, which is almost like 3 months. So these are features that you can categorize as mild to moderate. Now coming to the severe complications, complications are seen in patients who've had that kind of impact when the severity was high. Patients who landed up in the ICUs and then landed up on the ventilator and then tracheostomized and been in the hospital for quite some time because we've seen that it was a prolonged recovery. And initially with massive lung involvement, with high CT severity on the HRCT scans, with raised inflammatory markers in a cytokine storm, as in whom COVID had hit badly. These patients generally, the most common complication, because with that kind of lung involvement, has been fibrosis. Fibrosis is basically when your lung is supposed to be a sponge-like material. So the distensibility, the extensibility, the compliance of the lung generally takes a beating, and you have fibrotic kind of changes wherein it becomes thickened and hardened and something like cement-like, wherein the lung is unable to have its natural ability to contract and relax. So that is what fibrosis is basically about. But thankfully, post-COVID fibrosis has been reversible. It has not been something which is irreversible, something like you have in another condition like IPF, wherein the fibrosis in the lung generally is not reversible and it is prolonged, and most of the patients tend to be on oxygen and antifibrotics for the rest of their lives. So thankfully with COVID, the fibrosis has been reversible. So right initiation of antifibrotics, right initiation of medications to reduce fibrosis, and other lung rehab procedures that we have here also at Zoy, wherein we have lung rehabilitation programs for long-term patients with these kind of repercussions of the disease. So fibrosis is one. Secondly, definitely a lung when infected with COVID is weakened, and as a result is predisposed to a lot of bacterial infections, fungal infections. Tuberculosis is another very common finding because the lung with that kind of beating and when it's been infected, definitely it will take time. The patient is immunocompromised, and in a country like India where TB is so rampant, it becomes an easily predisposed to a TB infection, and that is something which also we have been encountering post-COVID TB. Tuberculosis is something which is common. The third common complication that I would say has been vascular abnormalities. Patients are more predisposed to heart attacks and stroke because the pattern of the disease in COVID is it's a procoagulable state wherein the tendency of blood to clot is high. Many people might have known, D-dimers and blood thinners being rampant, and blood thinners being given during COVIDs. So the tendency of the blood to clot is high in COVID patients, and as a result of which they can have vascular damages in the heart, maybe precipitate as heart attacks, MIs. In the brain can cause stroke. So this is one thing. Another thing which has to be carefully monitored: regular follow-up with a multidisciplinary approach, having a multi-system team with a team of doctors on board, like a pulmonologist, a physician, a cardiologist, a critical care consultant. I think getting evaluated is definitely mandatory. And the other thing that I would say is air leak or pneumothorax or pneumomediastinum. Because of a weakened lung, there might be rupture of air sacs and air spaces into the pleural cavity, causing air trapping and pneumothorax and pneumomediastinum. So these are evaluated for any kind of post-COVID related complications or any ill health that you might be encountering in your day-to-day life. I would request you to make sure you come down to a nearby hospital. You can avail my facilities at Joy Hospital, Sameerpet, and come down, have a thorough health checkup. We are a team of doctors on board, and we will make sure that any health related queries and issues can be sorted to the best of our ability. Thank you.